Hello student, today we will discuss about female pelvic inflammatory disease. Pelvic organs otherwise called as a female reproductive organs. So PID means infection or inflammation of the female reproductive system. It may be internal organ or external organ. So the female pelvic organs are divided into internal organs as well as external organs. Internal organs means the organs which are situated inside the body. External organs means it is outside where we can see it. So internal organs, as you know, ovary, fallopian tube, endometrium, cervix and upper part of the vagina. Where we cannot see it, it's situated inside the body. External organs, that is vulva, labia majora, labia minora, clitoris, vestibular bulbs, Bartholin glands and lower part of the vagina. Infection of any this part is called as a PID. See in the picture you can make out left side the organs are infected. When it is infected means how it will be. Right side you can see the picture normal anatomy. Left side the infected picture. The case of severe condition, pus will also form. In initial stage, if we are not treating means pus will also form. So it may damage the organs also. It may lead to permanent infertility. So what may be the causes for PID? So this PID is caused by either bacteria, virus or fungi. So the main causes for pelvic inflammatory diseases are multiple sexual partner. So multiple sexual partner and having sexual act without using any protective device. So what happens? There is more chance to get a sexually transmitted disease. So through this, the pelvic organs may get infected and not maintaining good personal hygiene. And the use of IUD, intrauterine device. See, once intrauterine device are inserted inside the vagina, it has to take care properly. So after the defecation and the urination, the woman has to clean the area properly, as well as once in a while she has to approach the doctor. If she is not following this, there is more chance to get the device may infect and it leads to infection of the organ also. So what happens? Sometimes this PID may lead to pelvic adhesion and scar tissue. Pelvic adhesion means it is an infected material like a white or a mild yellow in color. Okay. So when it is in active, the client may get abdominal pain as well as a discomfort. She may require like an antibiotic treatment, antibiotic as well as a painkiller and other treatment. So once treatment taken, it will subside. Then again it may reappear, that adhesion. So it requires proper investigation as well as a proper treatment. So what may be the signs and symptoms? As I said, PID means when a woman is infected, any of the organs are infected means like pelvic organ, she may be having lower abdominal pain, lower pelvic pain, pain during urination, pain during intercourse, increased foul smelling, vaginal discharge. So it may be white in color or a little red in color, or it mild yellow in color also. Due to infection, fever, chills will also there, fatigue will also there, nausea, vomiting will also there. Usually the symptoms of PID may resemble like medical problem. You may not realize it is a obstetrical problem, obstetrical or gynecological problem. You may approach physician also. Once physician come to know it is a PID, he may refer to female doctor also, like OBG doctor. How to diagnose this? History collection. After the history collection, usually the doctor will do clinical examination, inspection, palpation, percussion and auscultation. Especially when doing the palpation, when doctor with the finger touch and palpate, the client may feel mild pain also. And a vaginal examination also doctor could feel if any changes. So during the vaginal examination, doctor may collect a swab for culture and sensitivity to find out exact bacteria and treat according to that. Blood test, that is a CBC and culture and sensitivity. If infection means there will be WBC as well as the ESR will be increased. Pap smear test, it is a cervical cell test to know if any cancer or if any changes in the cervix. Ultrasound to know extent of the disease. Laparoscopy exactly to know what happened inside the organ and which organ is more affected. Cultosynthesis, a procedure in which a needle is inserted into the pelvic cavity through the vaginal wall to obtain a sample of pus. Means through the vagina only, ultrasound guided, they will collect a pus to know the exact bacteria. So management, since it is an infection, it is treated with the antibiotic. Usually it required antibiotic only, that is a doxy 100 mg or metronidazole 400 mg and ofloxacin 400 mg every 12th hourly for 14 days. Particularly if there is evidence of gonorrhea or chlamydia, means these two are a sexually transmitted disease. In case of severe infection, means the client is having multiple symptoms and client is very like vegetative or very in a lethargic condition, hospitalization with the IV fluid and IV administration of antibiotic is required. In case like very occasionally surgery is required, means in case of the internal organs are completely infected and damaged, means in order to save other organs, the which is completely damaged, their organs will be removed. So these are the nursing as well as a surgical, medical as well as a surgical management. Now as a nurses, what is nursing management? That is a assessment. As the client come and admitted in the hospital, it is our responsibility assessment, that is a history collection as well as a physical examination. Through the physical examination, we will come to know various symptoms. According to that symptoms, we have to form the nursing diagnosis, plan of action to decrease pain, what to do, to decrease temperature, what have to do, to decrease discomfort, what have to do. So all that and have to start to implement and have to evaluate also, and has to give education regarding female anatomy and physiology and regarding the safe sexual act and to avoid multiple sexual partner, and if it is a IUD insertion is done, means how to take care of that IUD. So all that education has to delivered by nurse. So if right time it is not diagnosed, if right time medications are not given or not treated, what happen? Complication. So it may lead to ectopic pregnancy as well as a infertility. Ectopic pregnancy means pregnancy may occur but it is away from the uterus, away from the normal. So it leads to ectopic pregnancy. There is no use. Immediately it may require the surgery and has to remove that product. Or infertility. Infertility means it may be a permanent inability to conceive only. So to avoid this complication as well as the damage of the organs, the immediately if any symptoms means without neglecting, the lady has to approach the obstetric as well as the gynecology doctor. Hope students you understood this. Thank you.